Hello and welcome to my YouTube channel. Hope you all will be doing great. Today I'm going to discuss some special tests and it will be starting from the hip joint. So as you can see on the screen that we are going to discuss the three main things in every test. Number first is the aim of the test and then we will be discussing the patient position and at last positive sign. Okay, so let's get started from the very first Thomas test. Okay, so what is the aim of this test? It's help us to identify the tightness of the hip flexors. As you can see in this picture that the patient is lying supine with one of his hip and knee maximally flexed to the chest and are held there, while the opposite limb is kept straight on the table. And what the therapist is going to do now, the therapist is going to observe if the Hip, hip flexion occurs on the straight leg as the opposite limb is flexed. Okay, so when we say that this test is going to be positive, it's going to be positive if the straight knee of the patient is going to flex, okay, and unable to remain flat on the table. And if the knee is straight, that indicates that there's a tightness in the rectus femoris. Okay, so hope you understand the stats that we can identify the tightness of hip flexors. Next, we are going to say the Ober's test. So, Ober's test basically identifies the tightness of the tensor fasciae lata or IT band, iliotibial band. So, as you can see in this picture, that patient lies on the side-lying position. Patient is in side-lying position with her lower limb flexed and the hip and knee. So, flexion is occurred on her hip and knee passively, and the therapist is going to passively extend and abduct his her testing hip with the knee flexed to the 90 degrees, and then slowly lower uppermost limb and observe if it reaches the table, and then he is slowly going to drop the lower uppermost limb and going to observe that if it reaches the table. Okay, so where is the positive sign? Positive if the uppermost limb is unable to come to the rest on the table. Okay, when we are going to say that the identify, we can say that there's a tightness of IT band or tensor fascia lata, that when the uppermost limb is unable to come to the rest on the table. So next we are going to have an Alice test. Alice test aims to identify the tightness of rectus femoris, and we can see in this picture that patient is lying in prone and knee of the testing limb is flexed. As you can see that knee is flexed and he is in prone position, and now we are going to observe that hip of the testing limb. Okay, we are going to say that what is going to happen on the hip joint, okay, when we are flexing the knee. Okay, so a positive sign, how we can say that it's a positive? It's positive if the hip of the testing limb flexes. Okay, when we are flexing the knee, the flexion is also occurred on the hip joint. So that identifies the tightness of your rectus femoris. Next, we have a 90-90 hamstring test. As we can see in this picture, that there is a 90-degree angle. Okay, so the aim of the test is to identify the tightness of the hamstrings. Patient position, patient is in supine lying and the hip and the knee of the testing limb is supported in the 90 degrees flexion. So here's the 90-degree flexion with the hip and knee, and passively, and the word therapist is doing that, he is passively extending the knee of the testing limb. And how we can say that it's a positive sign, positive if the knee is unable to reach the full extension. Okay, if your hams are tight, it means that your knee will not be able to achieve the full extension. Okay, so that's a 90-90 hamstring test. Okay, let's move on to the performance test. So, where is our performance test? Aim of the test is to identify the tightness of a piriformis muscle, and where is the position of the patient. Patient is in supine lying and the foot of the testing leg is placed lateral to the opposite limb's knee. As you can see in this picture, testing hip is adducted. Observe position of the testing knee relative to the opposite knee. Okay, so we are going to what a therapist is basically going to do that. He is going to observe the position of a testing knee relative to the opposite knee. Positive if the testing knee is unable to pass over the resting knee, or reproduction of the pain, or reproduction of the pain occurs here in the buttock or along the sciatic nerve distribution. So then we can say that the test identifies the tightness of the piriformis muscle. Then we can say that our piriformis muscle is tight. Okay. Next, we are having a FABER test. Okay, it's also called as a Patrick test or a figure of four. Uh, Aim of the test is to identify the dysfunction of the hip and sacroiliac joint, such as the mobility restriction. Okay, the word basically the aim of this test is to it identifies the hip and SI joint dysfunction. Okay, so what we are going to do that patient is in supine lying and passively flex abduct and externally rotate the tested leg so that the foot is resting above this opposite knee, as you can see in this picture. Then we are going to slowly down the testing leg towards the table surface. Okay, so when we say that it's a positive test, we say that it's positive test when the involved knee is unable to assume relaxed position. Okay, or if reproduction of the painful symptoms occurred. So it means that you are having a dysfunction of your hip or ilio SI joint. Okay, it may be some mobility restriction. Then there are some tests for your SI joint. How we are going to differentiate that whether it's a hip joint involvement or it's an SI joint, purely SI joint is involved. So we will be discussing that in our next video. Stay tuned and goodbye.